How do doctors monitor for cancer recurrence after treatment? Imagine finishing treatment and feeling hopeful, but wondering how doctors keep an eye out for cancer coming back. Monitoring for recurrence is a key part of survivorship and long-term health. It involves a mix of regular checkups, tests, and listening to how you feel. The goal is to catch any signs of cancer returning early enough to treat effectively, while also avoiding unnecessary tests or worry. For testicular cancer, doctors usually schedule regular follow-up visits. These include physical exams and discussions about any new symptoms. In the first few years after treatment, visits are more frequent, often every 3 to 6 months. During these visits, doctors may order blood tests to measure tumor markers like alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase. These markers can help detect recurrence early. Imaging tests like computed tomography scans or magnetic resonance imaging are also used, especially in the first 2 years, to look inside the body for any signs of returning cancer. Recent research suggests that magnetic resonance imaging might be a safer alternative to reduce radiation exposure, especially for low-risk patients, but availability and cost can influence this choice. In cervical and other reproductive cancers, follow-up often involves pelvic exams and pap smears to check for local recurrence or new lesions. Imaging tests such as ultrasound, CORT, or MRI might be used if symptoms suggest a problem. Routine imaging for asymptomatic patients is less common and depends on individual risk factors and treatment history. Blood tests are not typically used for surveillance in cervical cancer, but HPV testing and pap smears are important tools for ongoing monitoring. Patients are also encouraged to be aware of symptoms that could signal recurrence. These include new lumps, unusual pain, bleeding, or unexplained weight changes. Educating patients about these signs helps ensure they report any concerns promptly. Follow-up plans are personalized based on the type of cancer, how advanced it was, what treatments were received, and individual health factors. Usually, the most intensive surveillance happens in the first 2 to 3 years when the risk of recurrence is highest. After that, monitoring becomes less frequent but still important. While regular surveillance can improve outcomes, it's also important to balance the benefits with potential harms. Excessive imaging can cause anxiety, false alarms, unnecessary tests, radiation exposure, and costs. That's why doctors aim to tailor follow-up strategies to each person, focusing on what is most likely to help without causing undue burden. In summary, doctors use a combination of physical exams, blood tests, imaging, and patient awareness to monitor for cancer coming back after treatment. These strategies are based on scientific evidence and tailored to each individual's risk. Staying in regular contact with healthcare providers and reporting new symptoms early can make a big difference in managing long-term health after cancer. Remember, always consult your healthcare team for personalized advice and follow-up plans.